Well, thanks so much, everybody, for joining us this evening, giving up some of your Tuesday evening to join us for this street talk.
One of the things that I believe in is that the creative arts are a uniquely powerful way to confront and engage culturally sensitive issues. And I think that might be of some help in this forum. In fact, perhaps there's nothing as culturally sensitive right now as our health and the impact that COVID-19 has had on all of our lives. A recent report outlined the fact that obesity is a driving factor in COVID deaths. And the majority of global COVID-19 deaths has been in countries where over 50% of their population are obese. And strikingly, the authors of this report found that there is no example of a country where people are generally not overweight or obese having high COVID-19 deaths. And you may also know that the United Kingdom has the world's third highest coronavirus deaths and the fourth highest obesity rates. And I think the work of Sustrans in encouraging and facilitating walking and cycling are very important in this respect. And if we can use arts as a way of engaging people with these issues, well, you know, that's something that I truly am happy to lend my support to. In fact, I work with one of the leading lifestyle doctors to show people how nearly any chronic disease can be reversed through exercise and diet. And London, you know, has so much potential for people to walk and cycle in the most incredible environments. And sometimes people don't even realize what they've got. And one of the criteria is that you bring lots of different stakeholders together, even the opposition. You know, if you've got people with opposing views, very important to have those views represented. And it's a competition to work together to create the best or most sustainable or the most useful way of using this particular facility. And because it's competitive, people have to work together and they have to share their skills. They have to find out what skills each one has so that when they're working together, they can make the best use of each other.
And in order to allow people to get to the same outcome, we need to understand the different barriers and opportunities that affect different groups and craft our approaches, policies, and programs with those various challenges and needs in mind. And I think that's key, recognizing historical legacies of various forms of structural inequalities and their ongoing impacts, which have differential impacts on different groups in the population. We know that 26% of cycling journeys in London are made by women, and 15% of cycling journeys in London are made by BAME people. And nearly half of Londoners say that cycling is not for people like me. And I know there's been a big boom in cycling since the pandemic, but I think going forwards, a really important question is how do we make sure growth in cycling is inclusive and how do we sustain inclusive growth? There's been a lot of work recently around the link between new cycling infrastructure and gentrification, particularly in North American contexts. And John Stellan is a scholar who's done really brilliant work on this. And I think the key takeaway is that cycling infrastructure, cycling investments don't cause gentrification in and of themselves, but they occur within a broader context of neoliberal urbanism. And under this political economic context, the exchange value of public space, what it's worth in terms of investments or its potential to attract foreign capital, is privileged over the use value. And it's this very context that enables green gentrification, which is the unequal distribution of sustainable urban infrastructure investments in which the steer, especially in hyper-commodified urban spaces, is towards privatizing the benefits of green infrastructure rather than socializing them. The good news is, I'm sure many of you have seen the study that came out recently on the low traffic neighborhoods in London, done by the Active Travel Academy and Possible. And they found that across London, people in deprived areas were much more likely to live in or near a new LTN than people in less deprived areas. And the implementation of LTNs so far has been broadly equitable at the city level. And it's really promising that there are interventions that have been more equitable in distribution. And one way to try and make sure this happens from the onset is doing what Oakland's done in the newest Oakland bike plan with an equity framework. One thing they did was analyze people, particularly people living in disadvantaged areas, their access to key needs like grocery stores, shops and supermarkets, schools, libraries, parks, recreation centers, how easily it was to access these key needs within 10 minutes.
I just wanted to start off by saying yesterday actually was 8 years to the day that my daughter was buried. And yeah, every day is different for me. And I think I took a pause going to the cemetery and then on walking back. And I walked across the same road that contributed to her death. And I actually filmed it because a few people would have seen that I actually shared it on Twitter. And I had to ask myself the question, what has really changed since my daughter died? So I've managed to get this verdict. Oh, sorry, she's just distracting me. That's her picture on the back there. No, she's just distracting me a bit. So I sort of said to myself, what has actually really changed since I got this verdict for her? So we now all know that air pollution contributed to her death. And I think rather than just saying air pollution contributed to her death, let's go back a bit and look at the state Ella was in when she died at the first inquest. So I've never smoked in my life ever. And my daughter's lungs at the age of 9 looked as if she had been smoking at least 20 cigarettes a day. So what have we learned from Ella's death and what are we doing? And I think for this conversation, I would specifically, because it's about equity, I would like us to focus on the busy main roads in this country. And when I say busy main roads, we all know, unless there are people who've joined us from abroad. When you talk about busy roads, and let's focus on London, there are actually real life families who actually live on these roads. So that's a good starting off point to see. There's 250,000 children in London who have asthma. So these children come from certain backgrounds, and that's why I was really interested in what Tiffany was saying. It's very similar to COVID. So asthma disproportionately affects Black, Asian, minority children. Then I think we also need to look at where these children live. Of people who have actually approached me to speak about this topic, why I've been so ferocious recently about low traffic neighborhoods. So I said, well, do you really want to know the truth about it, why I am? I said, you do realize that children are actually still dying. You may not hear about them, but they are also still dying. And one of the things I think we need to think about is people who plan things, people who want to do things for people's health, are the right people getting the benefits from it. There's been lots of discussion, you know, about when you look at main roads and things like that, who is really living there and things like that. I'm not really sure whether I'm really so much interested in that conversation, or why don't we look at the children whose health is most impacted, where they actually live. But the reality is, in principle, it sounds nice and it's brilliant, and I wish something would work. But when it comes to the reality, it's actually different. So I thought, do you know what? Don't be biased. You know what to do because you're in the system. So what you have to do is do a set of lung functions. So you do one when it's really quiet, and you do one when it's really busy. And I've got another one lined up just so that I've got my ducks in a row, so I know what I'm talking about rather than just getting emotional about it. It's always good to have medical evidence, because this is what Ella's life and death has taught me. Having medical evidence is really, really important. And I notice, I think the problem with this whole conversation, and I need to speak to Stephen Holgate about it, I don't think people still understand what exposure to air pollution actually really means. Now, I still think what needs to happen is there still needs to be more education about the damage that cars do, because from where I'm standing, and I haven't been out for today, so I don't really know, but the fact that the road that contributed to Ella's death is now at least 4 times busier than it was before tells me something has sadly gone wrong. And when I looked at my own children's lung functions, I thought, goodness me, this is not heading in the same direction. So the correct direction. So if anyone thought that Ella's thing was the end of my stress, then they are unfortunately truly wrong.